much is health insurance going to cost for you in retirement? What sort of bite will it take out of your nest egg and your retirement income? New data from an updated Fidelity study. I got that and more coming up. My name is Mike Bernard. I'm the host of the Wise Money Show. I'm also one of the certified financial planners right here at Korhorn Financial Group. Make sure you hit that subscribe button, turn on notifications, and smash that thumbs up button. All right, when it comes to retiring, the three biggest worries, and I would put them in this order, are health insurance. How are you going to solve that riddle? When's the best time to take Social Security? How do you optimize that? And then how do you manage stock market volatility, okay? And those are the three biggest concerns you're likely facing. Yeah, how to replicate your income. I mean, Social Security is part of that income strategy. I mean, there's others, but my goodness, at the top of the pile is health insurance. And recently, Fidelity, and they do this once a year, they project how much you're going to spend on healthcare during retirement. Now, I've been, looking at this report every year for probably a decade, and it's always alarming. And yet, on top of inflation and everything else that's going on in the economy, it's an alarming number. This year's 2022 study from Fidelity on the amount of healthcare costs you'll face in retirement, they're projecting a 65-year-old couple should expect to spend more than $315,000 in total on healthcare in retirement. That is an alarming number. I'm thinking back, I'm trying to recall from history. It just felt like a couple of years ago, I was shocked because that was $250,000, something like that. When they include potential for long-term care insurance costs on top of that, or long-term care services on top of that, could be well over $400,000. That's not included in this study, but $315,000 for a married couple age 65, that's what you should expect. That's what they should expect to spend on healthcare in retirement. Another way of putting it is 15% of your annual income likely will be spent on healthcare costs. That is alarming. It's one of the largest expenses you're going to have in retirement. By the way, contrary to popular belief, most people think that's the largest expense. Typically, it's housing. Housing's your biggest expense, but at 15% of your annual income and a total of $315,000, health insurance cost is an enormous expense in retirement. So do you agree with this number? Are you prepared, and do you agree with this number? Now, to me, when you decide what to do with health insurance when you retire, that's the biggest health insurance decision you're going to make in your life. At a time when you want things to be simple, at a time when you're a little nervous about stepping away from that employer-provided plan, the plan that you've known all your life, you go into this new and strange, different world of health insurance, either getting some sort of coverage before you turn age 65, if you're retiring before Medicare, or at 65, or when you retire after age 65, signing up for Medicare. That's the biggest health insurance decision you're going to make in your life. And it sounds it sounds easy. It's a Medicare, right? But we've done lots of videos on this, and you need to work with the CFP who's going to help guide you through these choices and work with a health insurance expert. But by and large, you've got to decide whether you want traditional Medicare or whether you want Medicare Advantage. So traditional Medicare is Part A, B, D, and a supplement. Or Advantage is signing up for Medicare Part C, basically. And so that's at a high level, that's the big choice you make. And yes, there are some ways, once you make one choice, you can switch. And if you decide to sign up for traditional Medicare, you can, certainly switch to Medicare Advantage Part C, something like that. But it's hard to go the other way. Guys, it's almost like you got to view this as a permanent decision. Okay, so if I take a look at this study from Fidelity, and I do my own litmus test to say, well, is this some sort of scare tactic? Should you be worried? Something like that. Right now, unless you have to pay an income-related monthly adjustment amount, IRMA, unless you have to do that, your base Medicare Part B premium is $170 a month. Okay, $170 a month, 170, or I think 170, something like that, per month, per person. Okay, so Part A typically is not going to be at an additional cost. You've been paying into that system your whole life, so most people don't pay extra for Part A. Part B, $170 a month. Part D, it's going to be based on your plan. Let's just ballpark that to be $30 a month. And then a supplement will also be based on your plan and a few other factors. Let's ballpark that at $200 a month. So all in, Part B, Part D, and a supplement, if you're going traditional Medicare, $400 per person per month. So $800 total for a couple, $9,600 for the year. If you inflate those costs at 5%, which I know inflation is higher than that right now, but health and we hope that it comes down. We're all expecting that. How long can it stay at these elevated levels? Probably longer than any of us, well, it's already longer than any of us would have wanted. But hopefully inflation will taper off and come back down over the next year, 2 years, hopefully, okay? But health insurance costs, because of the nature of them, they tend to rise faster than inflation. So I think assuming that those costs increase at 5% over a long period of time is probably appropriate, hopefully accurate. Maybe it's even less than that, okay? But if I add that up and I do some future value calculations on that $9,600 a year for a married couple, increased at 5% a year over 20 years from age 65 to age 85, yeah, I get to about $317,000, $318,000. Now, if you live longer than 85, which I hope that you do, you're going to be considerably more than that. Now, this is just your premium. If you're doing traditional Medicare and the supplement that you get is the most comprehensive, then you will have relatively little out of pocket on top of that. But this isn't including dental coverage. This isn't including other things. So I actually think this Fidelity study, 315, is probably extremely accurate. But most of us should probably assume we're going to spend even more than that on healthcare in retirement. So my goodness, how do you plan for this? Okay, well, to us, it always comes back to that 5-factor retirement plan. Whether you're currently retired, on the cusp of retirement, or this is the biggest goal, a big goal that you're planning to achieve, work through that 5-factor retirement plan. The first factor about, determining this is what age you're going to retire and then what's your life expectancy. So age is the first one. The second, though, that's where health insurance needs to be baked in, and that is what is your spending in retirement. Now, your spending should be your base living, your normal everyday expenses, okay? But then you're going to add on some extra expenses in retirement. So you're going to add on, well, what sort of taxes will you experience in retirement? That's going to be different than during your working years. You're going to add in, extra family vacations or more discretion for family trips and that sort of stuff. You might add in new cars here or there, something like that. But then you're also going to add in health insurance. That needs to be specifically one of the listed expenses in retirement, because you're going to want to increase that. You're going to want to forecast that cost rises faster than the other expenses, okay? And so that's got to be part of your 5-factor retirement plan. Third factor is your income sources. So what are you doing with Social Security? What other income do you have? How much investments do you have saved up, and how much are you currently saving? Then how much risk are you taking in your investments? Those are very quickly those 5 factors. The key one here is spending. So whether you're still working and hoping to retire someday, you're on the cusp of making a big retirement decision, you're about to transition, or you're already there, you need to update that 5-factor retirement plan and make sure that built into that spending number is everything that I just mentioned. This much for Part B, this much for Part D, this much for a supplement, all of that totaling up to this increased at a probably 5 or 6% inflation rate from here in perpetuity. That's what needs to be baked in. That's the assumption that needs to be baked in for spending. And then based on the other choices you make for when you want to retire, your base spending and vacations, that sort of stuff, your retirement income, how much nest egg you've built up, and how much risk you're willing to take, you've got to see, well, do you have the right level of confidence that this plan is going to work? Or because these medical expenses are higher than what maybe you've expected, is your confidence level lower, and therefore you need to make a trade-off to ensure that you're on track and can retire with confidence. All of that is that 5-factor retirement plan. This news from Fidelity, when you add it all up, that's a lot. That shouldn't change your plan. You should have been planning for this all along. And if you haven't been, I'm not poking you in the eye, now's the time to start. plan for specifically health insurance as an expense within your retirement plan to determine whether you're on track and can retire with confidence. That's the work you should be doing with your certified financial planner. This is not back of the napkin calculation or free online calculator. You have no idea what assumptions are being baked into those tools. Use a 5-factor retirement plan with your CFP so that you've properly accounted for the best you can based on today's data, what health insurance, how much it will cost, and what healthcare will cost for you throughout your retirement. Work with your CFP on that. If you don't have a CFP on your team, you can contact one on my team. Find us online, Korhorn. Korhorn.com, that's Korhorn with a K, wisemoneyshow.com, you can find us there as well, or give us a call, 574-247-5898. All right, there you have it. Go out and take your next wise step in your financial life.